Today we're in the beautiful Santa Monica Mountains. We're here with Garry Lineham from Human Garage. What are we going to be doing today, Garry?
Today we're going to be teaching you how to take care of your own body and how to help others.
All right, let's go do it.
Let's go do it.
Shooting nerve pain that starts in my buttocks. It's burning. It's more of like electrical charge.
Oh, it's electrical. Okay.
Yeah. So and it rotates between my two sides. It'll progressively get worse over 2, 3, 4, 5 days to the point where I almost can't stand up. Mm-hmm. Or even if you're walking, you're like, oh, it's gone. And then you take a step and you get plugged into 220.
Okay, cool.
Yeah. I have x-rays, and I do know that in my, I think
Spinal
L4 and
stenosis.
L5, I have, some
So
cloggage
just so
there.
you know, everybody has a spinal stenosis.
Okay.
Like 90% of the population.
Oh.
That's how they bill insurance.
Oh, okay.
So they tell everybody that.
Well, so just from they showed me and they said I have like deterioration in some of that area, and that's what they said was causing it.
Yeah.
And then when I go to a chiropractor, he's generally able to fix it in the short term.
The reason it's going from side to side means that it's originating up here, not down in here.
Right.
There's other places.
Right.
And that is related heavily to this.
Okay.
So you got pressure right here. So this is all because of compression.
Okay.
So at the end of this time together, you're going to be taller.
Oh, good. I'll tell my friends will love that.
You
Jason,
will.
Anthony, I'm going to be taller.
We'll have evidence of that. That's why we're going to take pictures.
I had a growth spurt between 13 and 15. I grew 1 foot and an inch, or 1 foot and 2 inches. Went from 5'1" to 6'2", like in a year.
Yeah.
And my people always told me my hamstrings couldn't keep up with the growth of my bones.
Yeah.
So I've always had very short ones, and I would say that's probably the biggest difference right there, which is odd, is I just feel more limber through this part of my body.
More space.
Yeah, more space.
Because up here is your bladder meridian, which goes through and underneath the right through here up into the testes.
Really?
Yeah, and then it also continues to go all the way up here.
Wow.
So that is actually, bones are not structure because none of the bones in the body touch. So
That's true.
The model of chiropractic doesn't make sense to me, even though I was practicing, because structure is nailed and touches. So those bones actually float. So the muscles don't hold them up, because like the knee joint, you only get one muscle crosses the knee. It can't hold up the body.
Right.
Tendons keep it from pulling apart.
Right.
So the only thing you're left with is a meniscus. If it touches, it rips. And then the only other two things is skin and connective tissue, fascia.
And I guess in blood vessels.
Well, blood vessels are inside the fascia.
Inside the fascia, okay.
Yeah, so they're in the fascia. So
Right.
the fascia is the structure.
Right.
And if we think bones are the structure, we make a lot of decisions that aren't necessarily appropriate.
Yeah, I can see how that's logical.
That was my journey, but
Yeah.
that thought process took me 35 years.
Okay.
Okay, so there's a couple things I want to show you do yourself first. Okay, so come back here. And one more. Okay, good. Now these are the self-care movements, the fascial maneuvers. You're gonna feel a little high.
Yeah. Is that from the breathing?
Well, these are
turning?
only six breaths.
Yeah.
So if you breathe like that for 6 breaths, you wouldn't be. So it's
Right.
what we're doing is using compression in the body. The body's a hydraulic system.
Right.
That's our findings. And we're using that, so it's pushing blood and cerebral or spinal fluid and fascial fluid all around.
And I would guess that doing things that are different than what the body's normally used to do. Does this?
This is actually what the body should be doing.
But
Because
does
in
it,
nature, we move, we crawl, we move around, but we walk on flat surfaces. So this is not a normal behavior of the body. Normal behavior of the body is to get up, crawl around things, sit down like this. That's a normal behavior.
Okay.
So we're actually just restoring normal behavior.
Okay.
So go for a walk and then see how that feels.
Awesome.
And I'll ask you from time to time what you notice different.
Okay.
And it's okay if you don't notice anything.
Yeah.
But progressively, you're going to notice things as we go. You may not notice anything at first. As you go, you're going to go, holy crap, at some point.
Okay. Yeah, I noticed, at least after that, there was just heat, obviously, from probably the twisting, the compression, maybe, blood flow.
Yeah.
Yeah, definitely lightheaded. And I think that felt like it was my right side for sure. Like there's more blood flow, I think, on the right side of the body right now.
Okay, so one more lap now with that information.
Okay.
And then just feel how your body walks. Now, again, this is, by the way, I can see where your growth spurt happened. Because it takes your thighs in like this. So that's part of your problem.
Yeah.
Okay, a little bit more, I got you. 4, 5, 6. Okay, good. You're gonna be lightheaded again?
Oh yeah, for sure lightheaded.
So this is actually, this is the feeling of being high. This is actually what people go get drugs for. So gradually you're gonna get high through this process.
Okay.
Go for a walk again.
All right.
And then notice things like how your feet are landing, how your hips work, how your knees feel, how your shoulders, neck.
Yeah. Okay.
A little smoother?
Yeah. I feel smoother. I think I struggle a lot with my hamstrings, so that's something that it's starting to do there, but it takes me a long time to get warmed up, and I don't take yoga specifically because I usually fall over.
Okay. Can I get weight in the back? So what I'm going to do, actually, here's what I'm going to do. I'm going to show you how to do your hamstrings. Stand back a bit more. So
Okay.
The film here.
Okay.
So you're going to take both hands on your belly button. Go
right on it?
Yeah.
Okay.
Go over to the right.
Okay.
And then go down right above the hip. Right in here.
Oh, ow, ow, ow,
Yeah,
ow,
yeah. That's what we're going to grab. So maybe even get underneath the shirt so we can get some grip in there.
Yeah.
Okay, and then pull the skin right up. Okay, now what you're going to do is step forward with your left foot. Okay, and then look upwards and breathe. One more. Okay, good. Come on up. Now that one's gonna give a big blood rush to the head.
Wow. Yeah.
Okay.
Definitely. Why is there so much pain right there? What is causing that?
That's the valve between the small and large intestine.
Okay.
So all bloating, gas, distension.
Got it.
Go in there. Now when that gets pressurized, that causes pressure on your psoas and on your lower back. So that part of the pressure that you're trying to deal with, which is your sciatica activation, it's coming from there.
Okay.
So
yeah, I knew that. Isn't there another valve somewhere in here?
Yeah.
Right? I think somebody showed that to me one time.
Iliopsynctal valve.
Yeah, somewhere. Oh, yeah, that one I've worked on before.
That's it. So it goes between the small and large intestine.
Okay.
So every autoimmune disease in the world has that. Every bloating, gas, distension has it.
Okay.
So go for a walk now and then feel the difference between your right side and your left side. What do you notice about your right side?
My right side definitely feels longer. The left side is still tight for sure.
Yeah. So this is, I want to focus on the fact that how simple this is. These are things that you do by yourself. I'm just giving you.
I could do this without somebody holding me back like you. Maybe it wouldn't get as much.
I'm just giving you a little extra.
Give me a little extra, right?
But these are all things that you do.
But I could just go in there, grab that, pull up on it, kind of do a lunge, and then look up at the sky and lean back, and that's going to help.
And it's on video and it's free of charge, and it tells you how to do it. Yeah.
And it only takes
seconds to get
So
that. For gas, bloating, distension, autoimmune, eczema, rashes, rosacea, cold hands, cold feet, Hashimoto's, Graves' disease, all of those things are all affected by that one movement.
Okay. Well, I know my grandmother, a long time ago, she used to, if she had an upset stomach, she'd always tell us to go right here, and we'd go we'd do a counterclockwise motion. And I don't know if that was something older or passed down, but she always knew that.
80% of the care happened in the home by the parents and the mothers, and we knew this stuff as a society. Yeah. But over the last 40 years, all that information over 2 generations has been extracted so that we become dependent upon a system.
Right. Okay.
What do you notice now?
More balanced, I would say.
Yeah. What we're going to do is we're going to do totally twisted, these are the primary movements. Okay. So facing that way again. Take your right foot, cross it over. Take your right hand, put it underneath left hand, armpit, left hand on top. What we're going to do is be blowing your body up like a balloon. Okay. And these are attachments that hold it. So as you blow up, it creates compression. Okay. So I'm going to just hold you for stability. This is something you do by yourself. Pull on your belly button, squeeze your sex organs, okay, and put your tongue in here, and breathe. We do 6 times. Okay, now drop your tongue, and then purse your lips and go, hold it. Okay, a bit more, and exhale. And we're always going to do 3 or 6 breaths. The body likes numbers. Okay, now we got this side done. Now slowly what we're going to do is turn your head the other way and turn the body this way. Breathe in again. More. And exhale. Okay, now into the nose, not to the mouth. So unwind. Again, these are all things that you're doing by yourself. I'm just giving you an extra. How do you feel right now?
I would say definitely like a nice sweat over my whole body, which I don't sweat. I can go on the treadmill sometimes for 30 minutes and I'm completely dry.
Okay, this is a really good point. So we think that in the old way of looking at it, work equals force times distance. So I have to run on a treadmill for 40 minutes.
Right.
That's a metabolic function.
Right.
That means your body's actually burning what we would think is calories. I don't believe in that anymore, by the way. But
okay.
But that metabolic function happened by you not moving.
Right. It just heated up. My whole body heated up.
Right.
Yeah.
So we're engaging the body's natural systems to heat up the fascia, which creates a metabolic effect, which burns more calories than running.
Oh, wow. Okay. Now I don't have to stretch. I don't have to run. Perfect.
Well, so I look like I work out, right?
Yeah, absolutely.
I do 20 to 30 minutes a day of this, and I don't do anything else.
That's amazing.
And that's the whole point, is that the body, we shouldn't have to do all this work to maintain ourselves. I remember I was a bodybuilder trying to keep up.
Yeah.
And it wasn't working.
Yeah.
I was getting worse.
Right.
Okay, now walk and see how it feels. What do you notice that's changing for you?
I just feel right now just warmer kind of all over. I don't feel specifically anything that different as like with my...
Go for a walk.
Okay.
Okay, now I want you to just focus on your heel to toe roll, because it's going to change.
Okay.
Whether you're putting more weight on one foot or the other as you walk.
Yeah, definitely on my left foot still. I feel like I'm a little heavy footed. I think that's the only thing that I would say right now. I'm usually a little bit more light on my feet, and I feel like I'm actually a little heavier right now.
Yeah, you're actually starting to let your legs extend down so your heels hit, because when your heels don't hit, it causes the body to tighten up, which causes your sciatica.
That's probably it,
yeah, that's it.
I feel like even though that wasn't something where my hamstrings were really that much in play other than the twist, they're definitely feeling it all the way down the back of my legs. So
So keep walking.
Okay.
Yeah, so again, it takes out this whole belief system that hamstrings perform the way they do. Basically, your muscles are encased in fascia, and if your fascia, what runs through that is meridians to the organs. So up here is fear.
Oh, okay.
And that's bladder. And it's natural. I mean, we have lots of situations that we fear these days. I mean, it could be closing, it could be relationships, it could be fear of bodily harm, it could be fear of financial stuff. But those things are resonant in our bodies.
Okay.
And we used to move our bodies as a society. We don't do it anymore. At the end of the day, if you go back in the 40s, 30s, even in the cities, they would all come together and they dance. They're always getting together, they're always dancing, they're always moving, but we stopped doing that. We've been isolating when we go home and we order food. So let's face this way again.
Okay.
Anti-gravity, you're gonna put your hands behind your neck. You're gonna go down as far as you can, pull the skin up.
Okay.
And then you're gonna tighten your belly button and then look upwards. And then breathe in 3 times through your mouth. 2, 3, and then breathe in 3 times through your nose. Okay, now what I want you to do is soften your knees, stick your bum out towards Cynthia, and then flatten your spine and look upwards. And go down a bit more on your knees. Okay, now breathe in and look up to the right. And exhale down. Breathe in, to the left. And exhale down. Breathe in, up to the right. Exhale down. Again. Okay, so come up bum first. And leave your head down for a second. Slowly come up 1 vertebrae at a time. And then look at the sky. You're going to get a little bit high here. Okay, let go. Okay, give that a minute. So that one there, it's decompressing the whole spine, cerebral spinal fluid, everything.
Okay.
So that one there is like the best thing you can do for your body, literally.
Yeah.
Yeah, so these are natural movements of a human being. A monkey actually does it.
Oh, okay.
So what we're just doing is we're articulating it in a way that creates movement patterns and breath to trigger responses from the body.
Yeah.
Okay, so we're gonna do a couple for the head because I want to get you the full experience.
Okay.
Your thumbs, put them in your ears.
Okay.
And then grab the ear and torque it really hard.
Both sides?
Yeah. Okay,
Yeah, it
open and close
does. I
your
used to
jaw.
do this to my brother all the time.
Open and close your jaw. Look up and do it 3 times. Squat and go right to left. So these little puppies take 10 times more bandwidth from your brain, processing power, 10 times more than your eyes do.
Wow.
Okay. Now notice there's something changing in your hips and your back and your feet.
Yeah, I mean, right now I feel better all over. You just feel like you've kind of had a workout, or I feel good.
You feel like you worked out, feel like you did yoga.
But that workout where you kind of like the end of a hike where you're kind of energetic and you feel good. You know?
Right. Now, if we didn't talk, this whole thing is
Much
7
shorter.
minutes.
Oh, 7 minutes is all.
Yeah.
Wow, that's easy.
So what happens is we discovered that fascia actually moves the body, not brain and muscles. So muscles respond to the movement of the fascia, which is a completely different backwards way of looking at it, which is why releasing that science, I mean, that's like saying the earth is flat or round, or saying that there is no God.
Yeah.
So basically we decided to just release the therapies and let people try it for themselves, and then they could explain why it happens. Mm-hmm. Because we already have 20 million people around the world doing this right now after 3 years. We expect 250 million people to be doing this within a year.
That's amazing.
Yeah, we have hundreds of thousands of doctors that prescribe it every day right now. Because it has an immediate work, and it's something every practitioner wants you to be better. But if you rely upon me, you will never be better.
Right.
You have to have something that you can do yourself. Straighter, huh?
Yeah. It's great.
So what we did is we told your fascia through the center of your body to stop going side to side like it used to.
Okay.
And then all of a sudden it's straighter.
Yeah. And then the third eye thing, what was this right here?
Well, these are your center bones, one there, one there, and there's actually one more which I'll do for you which is right here on the sacrum. And this will even help it a bit more. So these are like when I get an Olympic runners, like all my Olympic runners have medals.
Yeah. Oh.
So what we do is we take these things are efficiencies are 3 to 5%. That's gold versus.
Right. Oh yeah. 1% is gold versus back of the pack.
So go for a walk now. We have some of the most elite athletes in the world starting to do this because, and I'm helping them personally because when they win, they have an edge, then everybody else wants to do it.
Right.
How does that feel?
Good. Really good.
Really smooth now, right?
Yeah. Feeling great.
It's pretty crazy, huh?
Yeah.
Because virtually you did this yourself, and the only thing I did was pulled your ear.
Yeah. I could pull my own ear.
Yeah.
Yeah.
You have your wife do it too.
Oh, she would love it.
Yeah.
She would love it.
Okay, so now what we're gonna do is we're gonna take and accelerate this. What you did was basically the stress reset.
This is something I could do at home. Wake up in the morning, do this, or in the evening before I go to bed,
and a lot more.
Okay.
Yeah, like.
But at the very minimum, you can get up and do this. And
this is called a 15-minute stress reset.
15 minutes. Okay.
And in a 15-minute stress reset, you can basically get all the flow back in the body and get your body moving all by yourself. It reduces stress by 75 to 90%. It increases oxytocin, serotonin, dopamine, the good hormones, and it allows testosterone to work again, estrogen, estradiol. So everybody's trying to take more testosterone, bioidentical hormones. They don't need any of it. You just need to stop what's causing those things to go down, which is stress hormones.
Yeah.
So we're taking the stress out of the body. It makes you self-managing.
Okay.
Now, if you're self-managing, you don't need a practitioner like me very much. Mm-hmm. And then when you do need me, we're just working on what you really need.
Okay.
So at the end of it, all body pain is caused by emotion.
Really? Mm-hmm. Okay.
100% of it. And even furthermore.
So even if I like swinging a hammer, and then I go and my arm hurts because I've been swinging a hammer, that's but from emotion?
Well,
or is that from overusing the muscle and?
Yeah, but think about your body as an individual unit. If I overuse it, what's it going to feel? Angry, sad?
Oh, you're saying the body feels those. So it's not necessarily emotions I'm feeling. So I could be completely stress-free and doing a puzzle, but if I did a puzzle for 4 hours, my fingers or my wrists might hurt, right? So that's caused from the body not wanting to do it for that long.
So here, I'll show you something. Sit here. I'm
Yeah.
going to create a little bit of pain in your body so you can feel something.
Oh, good.
Okay, so I'm going to show you how pain works in the body.
Okay.
And emotion. Okay, this should be painful.
Yeah.
Okay.
Definitely painful.
What's a level out of 10?
Oh, probably 6 or a 7.
Okay, I'll get it to about a 9. Okay, now touch it with your hand.
Uh-huh. Yeah.
Okay, take it away.
Definitely where some of my hands not on it.
Touch it with your hand.
Yeah.
Okay, take it away. Okay, now I want you to say, this pain is good for me.
This pain is good for me.
I feel the emotion of this pain.
I feel the emotion of this pain.
It's going down.
Yeah, for sure.
I can actually drive harder into there, so you'll feel me exerting more force.
Yeah.
More force, more force.
Okay.
So I learned a long time ago that the body has a pain of 2 out of 10. Everything over a 2 is the way I feel about it.
Oh, okay.
And so what we did is I gave you the ability to touch it, which means your body's saying, I need help over here. I need resources.
Right.
You put your hand there, the brain goes, okay, you're paying attention, so I can go off do my other things again.
Yeah.
And then you take your hand away, it says, wait a second here. I thought you were paying attention. So pain goes up.
Yeah, I think I've always kind of felt that way. Pain is an alarm. Pain is like saying, hey, something's going on here. You're getting bit by an animal, or your foot just got hit by a rock. And usually, when I touch things or you feel things, it does do that. I do understand that ability.
So using those mechanisms, I was trying to explain why it happens. So using those mechanisms, it's about resource allocation in the body and attention. And the body, it's really intelligent, and it just wants you to pay attention. Once you're paying attention, it'll solve itself.
Yeah.
But like when we have chronic pain over time, it's because we're not paying attention to something. This is going to hurt a little bit, okay?
Okay.
But the end result will be good. And we might even get a scream or two, which would be good.
Oh, good.
No, just kidding. Breathe.
Oh.
You got it. Breathe. Breathe. There it goes. Okay.
Oh, you are very good.
So that's my instrument.
Yeah, that doesn't feel good.
Okay, but now compare the right side of your face to your left side.
Yeah, it's definitely warmer over here. Yeah.
Does it feel like taller, maybe?
I don't know. I've never thought about the height of my face.
Or looser?
Maybe that side feels looser.
Yeah.
Yeah.
Okay.
You might get bit this time. Be careful.
Yeah, that's okay. Wouldn't be the first time. Almost there.
Oh.
Close. Okay, good.
Oh.
That was a good one.
That hurt.
Yeah. Okay, let's give it a second.
Oh, that hurt.
Okay, so I'm observing a much quieter demeanor of your nervous system.
Okay.
You may just feel it as calmer, lighter. Do you feel calm right now?
I do. I'm still
With the pain.
dealing with the pain in my left side. It's pretty severe.
Okay, I'm gonna lift your head. And your neck is, you can let it go. I got it. You're completely safe. It's gonna feel a little compromised at moments, but I will only take it to the ability of your body to move. Okay, that was a lot easier. Okay, now let's see what that experience looks like. Let's get up and go for a walk.
Okay. Whew. Well, the pain's starting to go in my jaw now. So.
Yeah.
Yeah, my walk is definitely smoother.
Yeah, and you're using your toes to push forward.
Yeah, it's not as heavy. I can definitely feel the floor a little bit more.
Okay, so this is really important. 22% of your forward motion is your toes.
Right.
So when your toes aren't touching the ground, you're actually, and we walk all day long, so that's 22% more energy.
Right.
Take that over the course of 5 years. That's massive. That's like 10 years of age.
Well, I live in Newport, so I rarely have my shoes on, and my daughter gets mad at me, so I use my toes a lot, I'm sure.
So now you're just going to use them a lot more.
I'll use them more, yeah.
Everything that we've done so far is available online, so practitioners can go and just watch this stuff.
Okay.
And then they can implement it themselves. I mean, it doesn't really take a lot of skill. It just takes doing it. And this is something that you could learn to do if you wanted to. Like anybody who does this 10 to 20 times is good.
Okay.
Okay, so just focus on that area.
Okay. Yeah, they're definitely tight right there.
Okay, so that's what we're unwinding.
Ooh. Oh, ouch, my shin.
Okay.
Wow.
Okay, so move that arm, Cynthia. And the leg, please.
I got it.
Okay. Breathe. Say hello, hello knee.
That's my inside groin.
Yeah.
Yeah, like heavy.
Breathe.
And then the hip here.
Yeah. So you breathe. Turn your head.
This way?
Sure.
Okay.
Say I'm ready to move forward in my life.
I'm ready to move forward in my life.
Okay. Now, consequently, when you did that, when you said that, the body loosened up. Okay, good. Move that leg for me.
Okay. Now that's the first time I felt my sciatica flare up just a little bit on the left side.
Perfect.
Just to let you know.
Yeah, okay, good.
Like I felt like it burning in my hip when you're doing it, and then when I straightened it out, I felt it a little bit.
Perfect. Okay, that's good.
That's good, okay.
Oh, okay, we're gonna loosen all this stuff up anyways. And your body's actually responding really well, despite the fact that it didn't have it.
Good.
Yeah. So we're opening up the areas that have this, which is called the bladder meridian.
Okay.
Okay, there it goes. So your bladder was actually stuck to your pubic bone.
Okay.
And when that happens, it forces the hips to anteriorly rotate, which then pitches your lower back. There it goes. Okay.
Felt that in my head.
Yeah, because that, remember I said that meridian goes all the way up here?
Yeah.
Yeah,
Yeah, it was like over in here.
yeah, isn't that crazy?
Yeah.
Okay, so bring your knees up, and I'm gonna walk up on you to stretch your lower back.
Okay.
And lift his head. Come up towards me. Okay, this is again a release you do by yourself, which I'm going to show you. But this is, I'm doing it with you. The difference is you'd be grabbing your own legs.
Okay.
There it goes. So, like a lot of people, you're how old again?
Be 53 in a few months.
Okay, so I'm 55.
Yep.
So most of the guys get to our age,
Yeah.
they start to have this issue in their hips. Almost everybody. Okay, you ready?
Yeah.
Let's go for a walk.
Okay.
See how that feels. And
Yeah.
I
I don't have no pains, no like, nothing really. I just feel really great.
fascial flow too, please. Yeah, so now we're done with pains. Let's go past pain.
Yeah.
Let's start thinking about what's changing from a performance perspective.
Okay.
So keep moving.
Okay.
Stand here, face this way.
Okay.
Okay, take your right foot, put it out like this. Okay, and lock your knee. Give yourself a hug. Okay, what you're gonna do is when I tell you to, you're gonna squat, you're gonna bend forward. Breathe. Breathe. So this is the core of your growth issue when you're a kid. You grew up so fast. Mm-hmm. The fascia around the bone tightened. I'm getting lightheaded now. And that caused your actual legs to do this.
Yeah.
So when you walk, you're actually slightly doing this because it was so tight.
Yeah.
We just unwound that.
Okay.
But that's from when you were a teenager.
Yeah.
Go for a walk now. You're gonna feel that leg compared to the other one. Your left one feels like a pole, right?
Yeah. Left one doesn't feel good right now.
Yeah, so basically, because of that contraction, it was winding you down into that leg, and you're trying to stand up, and the pressure is being felt here.
Yeah.
There it goes. Okay. That was.
Yeah, that side is a little bit different.
Okay. Notice how your hips are moving differently, your glutes are engaging, hamstrings have changed.
Yeah.
Now, we haven't stretched your hamstrings yet.
Yeah. Yeah, it feels good.
One more lap.
Okay.
Brain is calm.
Uh-huh.
Body is quiet.
Yes.
Ability to perceive the world around you is increased.
I think so. Yeah.
Okay.
Yeah.
And the emotion that you're feeling is.
Yeah. I think of like the main emotions, like, you know, anger, sadness.
Yeah, you're observing them.
Yeah.
That's what the way you're supposed to be.
Okay.
Is
Good.
observing your emotions.
Yeah.
Because otherwise, I feel a little agitated, a little angry, a little happy. But the most powerful state is to observe my emotions, not to be in them.
I feel present, I think, is a good way to describe it.
Yeah, and that is a present.
Yeah. Yeah, I feel great.
Okay.
Yeah.
So next one is a bit of a leap of faith.
Okay.
So
do a trust fall?
Yeah, kind of. You're going to fall backwards, but you can leave your legs locked. And when I tell you to, you're going to just hinge forward.
Okay.
I have 100% of your weight.
Okay. So lean back.
Just fall back on me.
Up.
Just to leave your arms to the side.
Okay.
Fall back on me.
Okay.
Got you. Now hinge forward. There you go. Breathe. So basically, we've been decompressing this whole body. That just allows a super decompression of the spine. Something you couldn't naturally do by yourself.
Yeah, I don't think I could accomplish that one.
Feels a little taller now, right?
Yeah, I do.
Okay. I think you just generally like to be a happy guy. Is that a good assertion? So when grief comes in your life, you happy it out.
Yeah.
And this is your lung meridian and your large intestine. When I was doing work on here, it's really red right here. You see this?
Mm-hmm. Yeah, bright red.
Okay, that's actually your large intestine meridian. Lung is in here, which means your body's holding a lot of grief. Purse your lips like you're sucking air through a straw. Breathe in. Push this out. Okay, hold on a second. Let me pull it in. Relax. Okay, now breathe in and push it out at the same time. There it goes. And let it. Again. And exhale. Again. So that's the most powerful support for the spine.
Yeah.
And you were breathing paradoxically.
Okay.
When you breathe in, you're supposed to go out like this. You were like that. It's from a lot of stress.
Right.
To go for a walk.
Okay.
And your body was just needed a reminder of how to breathe.
Oh.
Push up your chest and turn his head right to left there. Push your chest up more, shoulder up, and breathe.
Oh, wow. Oh, that's a lot.
Yeah. Okay, I'm gonna adjust, okay?
Okay. Oh.
Super easy.
A lot of cracks there.
Yeah. You know the funny thing is, if you put bones in a bucket of gel and you clack them together, they don't make a sound. So what do you think is cracking? It's the fascia. Tell that to chiropractors. Okay, get up and go for a walk.
Okay.
Now it should feel like everything's just kind of coming together.
Yeah, I'm feeling really good right now. Yeah, that's great.
Okay, when was the last time you felt this good?
Oh, I can't remember. I feel amazing.
Yeah.
Eyes are open and...
So your final walk, do a couple walks here.
I do feel like I'm standing up straighter without having to force myself or roll my shoulders or do something to make that happen. It just feels like I'm standing up straighter.
I'm adjust with my seat. Yeah, you are.
Your eyes are bright and you're taller.
Yeah.
Are you flirting with me?
A little bit.
Okay, actually, you want to see that? Take him to the mirror. Go to the mirror.
Yeah. Feel great.
Yeah.